When we talk about aging, we often picture wisdom, peaceful mornings, quiet routines, and the gentle beauty of a long life. But very few people want to talk about the changes that often appear in the final year of someone's journey. And yet, understanding these signs does not bring fear. It brings clarity. It brings compassion. It helps families prepare, support, and love more deeply than ever. Because the truth is this: when we recognize what is happening inside the body, the mind, and the heart of an older adult during their final months, we stop feeling confused and we start becoming present. We stop asking, why is this happening? And instead, we learn to sit close, to listen, to hold a hand, and to care with patience. Today, we are going to explore 5 major signs that many older adults show during their final year of life. These signs don't appear suddenly. They often arrive slowly, quietly, almost like the body whispering that it's getting tired. And while these signs are not predictions and they do not apply to everyone, they are patterns that caregivers, doctors, nurses, and families around the world have seen again and again. So if you are taking care of an elderly parent, or if you have someone you deeply love who is in their late 70s, 80s, or 90s, this video will help you understand what the body is truly communicating. And most importantly, it will help you respond with love rather than panic, with understanding rather than frustration, and with strength rather than fear. Take a deep breath, sit comfortably, and let's begin. Number 1, a noticeable decline in appetite and energy levels. One of the earliest and most universal signs is a slow, steady decline in appetite. It often begins subtly, skipping breakfast here, eating half a meal there, or saying, "I'm not hungry," even when food is offered. Many families worry and push food, but the truth is simple. An aging body slowly loses its ability to process energy the way it used to. The digestive system becomes less active. Metabolism slows down dramatically, taste buds weaken, the sense of smell fades, and the brain, which once sent strong hunger signals, now sends almost none. But it's not just the appetite that changes. Energy levels also begin to fall. An older adult might start spending more time sitting, resting, or sleeping. They move slower. They speak less. They show less interest in activities they once enjoyed. This is not laziness. This is not depression. This is the body conserving the little energy it still produces. In the final year of life, the body prioritizes essential functions: keeping the heart beating, keeping the lungs breathing, maintaining basic brain activity. Everything else, digestion, movement, physical hobbies, becomes less necessary. That's why many older adults eat very little, but still survive for long periods. The body adapts to a lower energy mode, almost like a dimming light. Families should understand this with compassion. Instead of forcing food, the best approach is offering small, soft, easy-to-digest portions, gentle hydration, comfort foods, and most importantly, accepting that this is a natural stage of aging, not a sign of failure. 2. Increased sleep and longer periods of rest. Another major sign that appears in the final year of life is a dramatic increase in sleep. You may notice that an older adult sleeps 12, 14, sometimes even 16 hours a day. They may fall asleep during conversations, during meals, or while sitting in a chair. Their naps become frequent and long. Their nights become deeper and quieter. This happens because the body no longer has the energy reserves it once had. The heart pumps more slowly, the lungs exchange oxygen less efficiently, muscles weaken, the brain reduces activity to save energy. Sleep becomes the brain's safest way to protect what is left. But here's something important. This increased sleep is not always peaceful. Some older adults experience light confusion when waking up. Some feel disoriented, unsure of the time or day. Some experience vivid dreams or brief moments of drifting, where they feel disconnected from reality. For families, this can be heartbreaking. You may feel like the person you love is slowly slipping away, spending less and less time awake with you. But in many cases, this stage is the body's natural way of preparing itself for the final transition. The kindest thing you can do is create a peaceful environment. Soft bedding, warm lighting, gentle conversations, calm touch. You don't need to wake them up or make them stay active. Just being present, sitting quietly beside them, provides more comfort than you can imagine. 3. A gradual withdrawal from social interaction. As older adults move closer to the final phase of life, you may notice something that is subtle at first, but becomes clearer with time. They begin withdrawing from conversations, gatherings, and even the people they love most. This withdrawal is not about sadness or rejection. It is not a sign that they no longer care. In fact, it is often the opposite. The brain becomes tired, overstimulated by things that once felt normal. Visitors talking, grandchildren laughing, family members asking questions. Even small conversations require energy. Listening, thinking, responding, and staying mentally engaged. During the last year of life, many older adults simply don't have that energy anymore. You may start seeing them sit quietly in the corner of the room instead of participating. They may prefer silence over conversation. They may answer with shorter sentences, choose fewer words, or sometimes not respond at all. Some may even prefer being alone in their room for long periods, enjoying the calm and stillness. This kind of withdrawal is a natural protective behavior. The nervous system tries to reduce stimulation, the mind shifts inward. Many older adults begin reflecting more deeply on their memories, their life journey, their relationships, and the meaning of everything they experienced. Families often misinterpret this behavior. They think the older adult is upset or lonely or feels ignored. But in many cases, this quiet distancing is simply a normal part of the final stage of life. The best way to support them is to respect their need for calm. Sit beside them without forcing conversation. Offer gentle companionship. Speak softly. Let them choose the level of interaction that feels comfortable. In this phase, presence becomes more valuable than words. Being near them, peaceful, patient, without pressure, is the greatest gift you can offer. 4. Physical changes and noticeable decline in strength. During the final year of life, the body shows physical changes that are difficult to ignore. These changes happen slowly but become more visible over time. One of the biggest signs is a loss of muscle strength. Tasks that were once easy become exhausting. Standing up takes longer. Walking becomes unsteady. Climbing stairs becomes nearly impossible. Even lifting small objects can feel heavy. You may also notice changes in posture, balance, and movement. Some older adults start leaning forward when walking. Others shuffle their feet instead of lifting them. Many begin using their hands to push themselves up from a chair. These are the body's strategies for compensating for lost strength and stability. Another common change is weight loss, not just fat loss, but also muscle loss. The face may look thinner, the shoulders may appear narrower, clothes may become loose, hands and legs may look more fragile. This is because the body is no longer rebuilding muscle the way it used to. Protein absorption decreases, appetite falls, the natural process of muscle breakdown speeds up. You may also see changes in skin color, skin texture, or circulation. Some older adults develop cooler hands and feet. Skin may look pale, thin, or slightly bluish in areas with poor blood flow. These changes often reflect the body redirecting energy away from the skin and muscles and focusing on essential organs. These physical changes can be emotionally challenging for families to witness. It is difficult watching someone who was once strong and independent become physically weaker. But this is a natural part of the final stage of aging. The best way to help is to ensure safety, using mobility aids, installing support bars, reducing fall risks, and offering assistance with dignity and respect. Instead of saying, "Be careful, don't fall," say, "Let me help you." Instead of pushing them to move faster, encourage slow, steady movement. Patience becomes a form of love during this stage. 5. Cognitive slowing and periods of confusion. One of the clearest signs of the final year of life is a noticeable slowing in cognitive function. This does not always mean severe dementia. It can simply mean the brain is tired, less able to process information, and slower to form new thoughts. Many older adults experience periods of mild confusion. They may mix up dates or forget simple details. They may repeat the same questions or get lost in the middle of a sentence. They may pause longer before responding or take extra time to understand what someone is saying. These changes are not intentional. They are the mind shifting into a slower, more fragile state. Some may experience sundowning, where confusion becomes stronger in the evening. Others may have short moments where they seem distant, disconnected, or almost as if they are dreaming while awake. These episodes can be brief but noticeable. Families sometimes panic when these changes appear. They worry something is terribly wrong. But this is simply the natural progression of aging combined with reduced oxygen flow, lower blood pressure, and decreased brain activity. The most compassionate response is gentle communication. Speak slowly. Use simple sentences. Give them time to understand and respond. Avoid correcting them harshly. Avoid arguing. Their world is changing and they need reassurance, not pressure. Cognitive slowing is often one of the final signals that the body and mind are preparing to wind down. It may be difficult to witness, but kindness makes the experience far more peaceful for everyone. Understanding these 5 signs does not mean predicting exactly when someone's journey will end. Every person is unique, and many older adults show these signs months or even years before passing. But recognizing these patterns helps families reduce fear, avoid misunderstandings, and respond with patience. Aging is not something we can control, but compassion is. These signs remind us that the body and mind naturally slow down as life moves toward its final chapter. When we understand what is happening, we care better. We speak softer. We listen more. We appreciate the time we still have. Supporting an older adult during this stage does not require advanced medical training. It requires awareness, gentleness, and presence. And sometimes, simply holding a hand, sitting quietly, or offering a warm drink is more powerful than anything else. If you have someone in your life who is experiencing these signs, now is the time to cherish every conversation, every smile, every peaceful moment.